Hi, my name's Emer McEntee, and I'm going to be presenting on a project on improving analgesia prescribing practices in St.James's Hospital, Dublin. And this project was done alongside Dr. Claire Healy, Dr. Sean Rooney, and Dr. Aine O'Gara in St.James's Hospital. So this project mainly focused on looking at interim analgesia prescribing. So, a bit of background. So, effective pain management on hospital wards is essential, a challenging task, particularly for first year doctors. So, interns frequently contact the St. James's Hospital pain service with queries related to basic analgesia prescribing, highlighting a gap in both their confidence and their knowledge when leaving college. So, the main aims of this project was to identify barriers to safe and effective analgesia prescribing among interns in St. James's Hospital, as well as that to evaluate the impact of a dedicated teaching intervention designed to improve prescribing and confidence and competence. So a bit about our methods. So we sent out a survey. So a pre-intervention survey was distributed to all St. James's interns 1 week prior to a dedicated teaching session. The survey assessed self-reported confidence in analgesia prescribing using a Likert scale, and it identified perceived barriers and evaluated prescribing practices via clinical vignettes. And then regarding the teaching intervention, so there was a one-hour evidence-based teaching session delivered by the St. James's Pain Fellow during protected intern teaching time. The session used the St. James's Medicines Guide app, which is accessible to all staff and is used as a core resource to all healthcare staff in James's. And a follow-up survey was then administered to the attendees of the teaching intervention to assess changes in both their confidence and their clinical decision making. So regarding the results, so the main key barriers that were identified included limited senior support, complex patient profiles, and uncertainty regarding safe dosing. So when we look at our results pre-intervention, so 28 interns completed the initial survey. Only 28.6% of those reported prior formal education on opioid prescribing, and the majority of them ranked their confidence as moderate for both inpatient and discharge prescribing. Post-intervention, 21 interns attended the session and completed the follow-up. Over 90% of them reported feeling very comfortable prescribing analgesia after the session. And we can see that in our bar chart towards the bottom of the slide. And then a bit about the discussion. So interns face multiple barriers to confident and safe analgesia prescribing, as we saw. And this teaching intervention is targeted low cost tool, which significantly improved prescribing confidence and decision making in St. James's Hospital. And the model that was used can easily be replicated in other institutes to enhance intern prescribing safety, their confidence, their competence, and overall patient care outcomes.